Coming up, our quad foam roll. We'll be starting off in a prone position on our forearms, bouncing our quads on top of the foam roller. Now we'll start right above the knee and start to roll towards our pelvis or the opposite direction. Either way, we'll begin. As we start to make our way up or down our quads, slowly notice that if there's any tension that the foam roll hits. If so, we hold the foam roller against that knot, slowly pushing it out. Again, our range of motion should be slow and controlled as to slowly push any tension that we may hit. Make sure we stay above our knee complex and right below our pelvis. Good. 3, 2, time. Coming up, our IT band foam roll. We'll be starting on our side, on our forearm, having the foam roller start just right below our hip, moving along the side of our leg. We can always bend that top leg over to take pressure off of the IT band, or we can stack our feet to add. Let's begin. Again, starting below the hip, slowly moving down the side of our leg, rolling out any tension we may hit. Make sure that our roll is slow and controlled, going about 1/2 inch per second, and stopping along any knots. Feel free to use that top leg to help alleviate some of the pressure if it gets to be too much. Make sure we breathe. Good. 3, 2, and we'll switch sides whenever you're ready. Good. Again, we want to start below the hip or above the knee complex, slowly making our way up or down the side of the leg. Again, make sure that we stay north of the knee or south of the hip. 10 seconds, making sure we breathe. Good. 5, 4, 3, 2, and time. Coming up, our adductor foam roll. Our adductors are our inner thighs. So we'll start off on our forearms in a prone position, stomach facing the ground, but with our knee opens up and our inner thigh facing the ground. We'll roll right above the knee and right below the hip. Let's begin. Starting off with the inner part of our inner thigh, just below our pelvis, we'll roll about 1/2 inch per second, slowly pushing out any tension that might be in that inner thigh, in that adductor. Make sure that if we're rolling towards the knee, that we stop right before we hit the knee, staying above the knee, and again below the pelvis. Making sure we breathe. And in 3, 2, we'll switch sides. Good. Bring the foam roller to the inside of that other leg, opening up that inner thigh to face the ground, hip square with the ground. So our knee is out to the side. And again, slowly making our way, stopping at any knots, and making sure that we breathe. Good. 3, 2, and time. All right, so here we're going to be foam rolling our piriformis. Our piriformis foam roll, we want to make sure that we cross one ankle on top of the other knee. Now the leg that's on top, the crossed leg, that's the side we want to lean to. So if our right ankle is on top, we lean to the right side. And let's begin. Now it might take a second to kind of roll and find that exact right area, but once we find any tender or tight areas, slowly roll again to release any fascia, any tension that might be in that piriformis or that glute area. Making sure again that the leg on top, that's the side that we lean to, favoring that side so that way we can push out again that tension. 5 seconds and we'll switch. Nice. And we'll switch legs. Go ahead and bring that down. Bring the other leg on top, ankle on top of the knee. And again, the leg that's on top, we lean to that side. Good. By having that leg on top, we can then open the piriformis and allow for the foam roller to get inside and push out any tension that may be there. Good. 8 seconds. 4, 3, 2, and time. Coming up, our hip flexor stretch. We'll be starting off on a knee with that opposite leg extended forward, making sure our front knee is directly over our ankle, and the knee that's down, that same side arm will reach up to the ceiling. Good, in 3, 2, let's begin. Again, the knee that's down, that same side arm is up. Once we extend that arm up, we want to turn towards that knee, towards that raised arm shoulder, slightly rotating our body to going to lengthen out inside our abdomen as well as our hip flexor. Good, breathing, neck and shoulders relaxed, creating length to the abdomen and the middle section of our body. And whenever you're ready, we'll switch sides. Take that knee down, step the other leg forward. Remember, the leg that's forward, that knee stays over the ankle. Whatever knee is down, that same side arm is up. Good. Looking up towards that hand, slightly rotating our body to create more length again to that abdomen, psoas, and hip flexor. Breathing. And we'll be done in 3, 2, time. Coming up, our adductor stretch. Starting with a wide base and our toes slightly turned out, we want to bend into one leg, straightening out our other leg that we'll be stretching. The straight leg will stretch out that groin in that adductor, while stationary in that opposite leg. Let's begin. Again, make sure that we're pushing our hips back, keeping our chest up. The bent leg, that knee stays right in line with that ankle. Straight leg, we feel a good stretch to that groin. Make sure that our chest is up. If we notice that we're looking to the ground, look back up, bring your shoulders back, and make sure that we're stretching the right way, maintaining our posture the right way. Breathing. And whenever you're ready, we'll bend to that opposite leg and switch sides. Good. If we notice any discomfort in our knee with this stretch, we can always push our hips back against the surface so that way we can take pressure off that bent knee and focus specifically on that inner thigh. We can always lean up against a chair, a bench, or some sort of stable surface if necessary. Keeping our chest up, and time. Coming up, our bicep femoris stretch. Our bicep femoris is the outer part of our hamstring. So we're going to be starting on a supine position on our back. This exercise does require either a band or a belt or something that we can place around the ball of our foot to add some extra stretch. Allowing our leg to go across the body slightly, let's begin. Make sure our toe is flexed and the leg that we're stretching, that leg is straight. Pushing through our heels so that way we lengthen our hamstring, and make sure that the strap, band, or whatever we're using to pull our toe back is firmly under the ball of the foot. Making sure that leg goes across the body just slightly. So it's either at 1 o'clock across the body or at 11 o'clock across the body. Good. 3, 2, and whenever you're ready, we'll switch legs. Again, placing that band or strap around the ball of the foot, leg straight, leg goes across the body just slightly, either to that 1 o'clock or 11 o'clock position. Make sure our hip, the hip of the stretching leg, stays on the ground. We want to instead create length to that hamstring, specifically the outer hamstring. Good. Another 3, breathe, 2, and time. Coming up, our hip abduction. We'll be lying on our side, on our elbow, and we want to lift our top leg for a 4 count, hold the top of the position for a 2 count, and lower for a 2 count. Make sure we're lying all the way on our side so that way we can have efficient work and full range of motion. Let's begin. Lifting 1, 2, 3, 4, hold 1, 2, lower 1, 2. Good, lift 2, 3, 4, hold 1, 2, lower 1, 2. Good. 4 count on the lift, 2 on the hold, 2 when we lower. Making sure that we're engaging our glute as we come up, but everything is very slow and controlled. Again, 4 count on the lift, 2 on the hold, 2 on the lower, and we'll switch whenever you're ready. Make sure that that bottom leg is bent with the heel behind us, top leg is straight with our toe flexed. 4 seconds on the raise, 2 on the hold, 2 when we lower. 1, 2, 3, 4, hold 1, 2, lower 1, 2. Good. Controlled. And our last one, and time. Coming up, our pointer. This exercise, again, will lift for a 4 count, hold for a 2 count, and lower for a 2 count. We want to start in the tabletop position with our shoulder above our wrist and our hip above our knee. We'll lift our arm and opposite leg for a 4 count, hold for a 2, and lower for a 2. Let's begin. Lift 1, 2, 3, 4, hold 1, 2, lower 1, 2. As we raise our arm and leg for the 4 count, we drive our belly in, hold up for a 2 count, lower for a 2 count. Good. Driving our navel in again as we extend, making sure that the foot that we're extending back, that toe, is facing the ground. Good. 4 on the lift, 2 on the hold, 2 when we lower, and whenever you're ready, we'll switch sides. Good. Again, 4 seconds. 1, 2, 3, 4. We hold 1, 2. We lower 1 and 2. 1, 2, 3, 4. Hold 1, 2. Lower 1, 2. Good. 4 on the lift, 2 on the hold, 2 when we lower down. Good. Our last one, and our time. Coming up, our stability ball bridge. We'll be working our glutes here, resting our head on a stability ball or any flat surface that we can use, allowing our hips to move freely. We'll lift our hips for a 4 count, hold the top position for a 2 count, and slowly lower down for a 2 count. Let's begin. 1, 2, 3, 4. We hold 1, 2, and then we lower down 1, 2. Good. Lift 1, 2, 3, 4. Hold 1, 2, lower 1, 2. Good. Making sure that our head stays on the stability ball or whatever surface that we're lying on. Also making sure that our knee is over our ankle. If we notice that our feet are too close or too far, feel free to adjust. Make sure our feet are hip distance as we execute the motion. Good. Raising 1, 2, 3, 4. Holding for a 2 count. Lowering for a 2 count. Good. 1, 2, 3, 4. Hold 1, 2. Lower 1 and 2. Good. We stay with that. Again, keeping our head rested. Just driving through our tailbone, engaging our glutes at the top, relaxing at the bottom. 1, 2, 3, 4. Hold 1, 2. Lower 1, 2. Good. We're almost there. Last one. And time. Coming up, our lateral tube walking. We can also do this exercise without the ankle band if one is not available, taking little steps just as we do with the band. If we are using the resistance band, it's important to keep tension on as we walk laterally, side to side. So as we bring our feet closer together, we still keep tension and distance between. Let's begin. Starting in our quarter squat position, we'll step outside of our framework, wider than shoulder width, and then bringing that foot back about hip distance, making sure our feet do not come any closer than hip distance as we walk side to side. Once we get the distance that we need, be it within the space that we're working in or just a certain number of steps, we'll go and walk back the opposite direction, leading with that opposite leg. Anytime we have any pain in our lower back, we just come up and we shake our legs out and go back into our quarter squat position when we're ready. Make sure our chest does stay up and our hips are back so that way we can keep pressure off our back and engage our glutes the right way. Also be mindful of your knee. If our knee is buckling in, we should abduct it, slightly rotate it out so our knee is in line with our ankle. Good. Keeping our legs in alignment as we step. One more step and time.